Okay, well, a very warm welcome to everybody. 8 years ago, we had the 40th anniversary of human sciences. That's the 40th anniversary from when the first graduates graduated from human sciences. And we had a big celebration during this very alumni weekend. And I organized a dinner, which, because of course all the undergraduate colleges were fully booked with their own alumni, the only place we could hold it was in All Souls. So it was a slightly nerve-wracking evening for me. The phrase herding cats comes to mind, but I think it was a pretty wonderful evening all round. And more importantly, well, let me first say, in 2 years' time, of course, what that means we'll be celebrating 50 years of human sciences. So we're already thinking about how to do that, and of course very worried about what the current COVID situation means for that. But any ideas that anybody would like to offer for that occasion, please, or wants to be involved, please get in touch. But what I wanted to say, more importantly, was we had a very nice panel and workshop in the Pauling Human Sciences Centre, and the then Vice-Chancellor, Andy Hamilton, came along and gave a wonderful 9-minute speech about how fantastic human sciences is, how shocked he was when he came to Oxford and saw how narrow the typical Oxford undergraduate degree is, and how impressed he was by the existence of human sciences. So it's a real positive endorsement of human sciences and what it has to offer. And it's only taken us 8 years to digitize that film of him saying this speech, and that is our first item on the new Human Sciences YouTube channel, which I hope you're all going to rush out and subscribe to straight away. So without further ado, let's move on to today's discussion, which is about, we've got an hour. We have to be very strict about that because somebody else has booked the university Zoom channel. So we have to finish at 5 promptly. So I'm not going to introduce the panelists, they're going to introduce themselves. And what we're talking about is interdisciplinarity, the importance of interdisciplinarity in the pandemic era. And first up is Dougal Jeffries. Dougal, over to you.
Thank you very much, David, and good afternoon, everybody. Yeah, my name's Dougal Jeffries, and my only qualification for speaking, I think, is that 50 years ago exactly, I was one of the very first intake to complete the full 3-year undergraduate course in human sciences. I had gone up to Oxford intending to read botany or possibly forestry, I can't remember. But shortly before I got there, I heard about the new course and I had no hesitation in changing to it, to the great disapproval of my college, which was University College. And I gather that, true to form, they still disapprove of human sciences. At school, I'd been very enthusiastic about animal behavior, ecology, genetics, and human evolution. Well, all evolution. And also acutely aware of my complete ignorance of the humanities and social sciences. So the human sciences curriculum turned out to suit my interests perfectly. Amongst my most treasured memories of that time are sitting literally at the feet of Nico Tinbergen in his house in North Oxford, when he was talking not about animal behavior, but actually about observing severely autistic children. And also for the bravura lectures delivered by a young postgraduate by the name of Richard Dawkins, provocatively entitled Survival Machines. And I was also fortunate enough to have a term being tutored by Richard, which I've never forgotten. After graduation, I worked as a lab assistant in the Department of Biological Anthropology, as I think it was called, with Professor Jeff Harrison. And I did such things as measuring catecholamine metabolites in the urine of my colleagues, measuring marriage distances in the rural population of Otmore, and working on a presentation for a paper for the UN Environmental Programme with Jeff Harrison. I also helped to redraft the syllabus for the human ecology component of the human sciences degree, increasing the emphasis on resource depletion and environmental degradation. But I've no idea whether that's left any traces 50 years later. Those were the days of the Club of Rome's report on the limits to growth, of the memorable book by Barbara Ward and René Dubos entitled Only One Earth, the care and maintenance of a small planet. We knew then about greenhouse gases and our fatal dependence on fossil fuels. And I remember one book that particularly struck me, which was titled, or possibly subtitled, Potatoes Made of Oil. Those of us who took an interest in such things then would have been incredulous had we been able to see that 50 years later, the threats already spelled out at that time would still be so far from being generally understood, let alone confronted by meaningful international action. In 1975, I took up a postgrad scholarship at the Australian National University in Canberra, where Professor Stephen Boyden was running one of the few truly interdisciplinary groups focusing on human ecology. I did my PhD on food habits and beliefs, based largely on fieldwork in contrasting rural and urban environments in Papua New Guinea. After completing my thesis, I distinguished myself by being the first, and for all I know, the only human sciences graduate ever to have been failed in their doctorate. No doubt there were sound academic reasons for this, but I've always rationalized my failure by telling myself, and anyone else who'd listen, that my work fell between the interdisciplinary stools of social anthropology, human nutrition, and human geography, with each of my examiners insisting that I should have gone into greater depths in their particular discipline. It was suggested I should go back to PNG to do more fieldwork, but by this time I'd taken the easier course towards becoming a doctor by enrolling at Southampton University Medical School, where ironically enough, interdisciplinarity was integral to the then innovative medical curriculum. I went on to become a GP, where of course one is trained to know a little about a lot, although I might add that generally your patients expect you to know everything about everything. I'm certain that my human sciences degree helped my understanding of many aspects of medicine at both the individual and the population level. Outside my work, I've always retained an interest in evolution, genetics, and human ecology. And as I've watched with growing concern the threats of overconsumption, habitat destruction, and climate breakdown grow, I've often wished that those in positions of power had a wider understanding of these areas of knowledge. Had we been here a year ago, I would be arguing that confronting the climate crisis demands such understanding. But today we're discussing the related but more specific threat of the coronavirus pandemic. The origins of the pandemic lie in changes in humankind's relationships with the natural environment and the consequent emergence of novel zoonoses. Its management requires an integrated understanding of epidemiology, of demography, of group and individual psychology, of quantitative methods, and of social institutions. In other words, just the kind of understanding that the human sciences course with its interdisciplinary ethos is designed to foster. In conclusion, I'd just like to say this. One of the driving forces behind the establishment of the human sciences degree was the then Professor of Zoology, John Pringle. In one of his presentations on the proposed new school, I remember he expressed the hope that one day we might have a Prime Minister who had graduated with a degree not in PPE or classics, but in human sciences. We're still waiting, but I can't help but wonder whether such a person might not have done a slightly better job in this crisis than the current incumbent. Just saying. Thank you.
Lovely, thank you so much, Dougal. Thanks for keeping for time. Lynne, over to you. You want to share your screen? And unmute, don't forget to unmute yourself. Everybody else, please keep yourself muted. I forgot to say that at the beginning. And we'll take questions once everyone's spoken through the Q&A button.
Right. Just 2 seconds.
Great, there you are.
So great. I can sort of bounce off Dougal really, because I joined the same course as him, but I joined it in the second year, having come up as a geographer geography was a perfect subject for someone who wanted to know something about everything, but no special talent for learning everything about one thing in particular. And I was so excited to find this degree with anthropology taught by Professor Evans Pritchard and Shirley Ardner and Edwin, and animal behavior taught by Nico Tinbergen, and it just seemed wonderful. It also fit with my sort of, I wanted to be an explorer. I hope you know who Florence Baker is down the corner. I was inspired by the Boas brothers who worked with Yanomami in Brazil. So I thought, okay, I'll do lots of anthropology, I'll learn about other things, and I can go and be an explorer. I'm trying to change my slides. I'm sorry, it's just getting right. But actually, those Boas brothers that I showed you made me realize that one could perhaps be more useful if you did medicine as well as exploring, and then you could use your anthropology, you could use all the other subjects you've studied and be a better doctor. And I actually think human sciences should be a prerequisite for all doctors. I mean, it's interesting how many human scientists went on to do medicine from those first 2 years. And I think, as Dougal said, medicine at its best is a completely interdisciplinary subject. It requires you to make connections between the social, political, biological, cultural, and psychological worlds and see how they impact on health. And what you can do to address and prevent them. At least that's how I see it. Unfortunately, many of my medical colleagues didn't see it that way, as you see from this career advice I got at various stages. Even at the very beginning, when I suggested that I might do psychiatry, because that seemed one of the most interdisciplinary areas of medicine, you couldn't do it if you weren't interested in the social, political, and cultural world of your patients. And my medical colleagues up in Edinburgh greeted this idea with horror. And then there was a nuclear threat that was kind of looming over us in a very visible way in the 80s. So I actually said I was going to resign and go and live outside a nuclear missile base, because I saw nuclear weapons, again, I think influenced by making social and political connections, as the biggest threat facing us in health terms. And I was told, well, that would be the end of your medical career. And definitely, if you go to prison, that would definitely be the end of your medical career. And then when I came back into psychiatry, luckily, I did get a job again, and I was welcome at Oxford. I went there to do psychiatry, which I loved. But when I suggested at the 4th or 5th year of my training that I wanted to do a PhD in social sciences, in social psychology and political science, again, very much a human sciences perspective, studying the peace and human rights activists with whom I'd been working, in fact, with a kind of ethnographic lens, I was told again, that'll be the end of your medical career. You can't go off and do other subjects. And then when I said at the end of all of this, I'm going to be an aid worker and use all of these subjects, I thought, oh, this is really not good enough. So, but that's what I did. I went off to the Balkans. I spent the next decade there. And I will again say that anybody contemplating a humanitarian career, do human sciences. It's been absolutely essential basis. When people come to me and say, what do I do to do relief work or humanitarian work, I say, well, do anthropology, do psychology, do political science. You need somewhere where you can get a cross-cultural and global perspective, and that's a good starting point. The interesting thing too is how psychiatry has shifted in the humanitarian world. It's a talk in itself. But again, what I'm glad to say is in the last decade, we've gone from this biomedical focus on PTSD, everybody has that, needs a medical intervention, to a much broader recognizing mental health is a cross-cutting, interdisciplinary issue far beyond PTSD. Psychiatric disorders are only one part of a mental health spectrum. Psychosocial needs are enormous, and you can only address the mental health needs if you take, if you like, an interdisciplinary lens. You look at people's basic needs for food, shelter, security, their social needs for connection and justice. You've got to address those in a dignified and equitable manner. And again, I don't think I would have helped to create this perspective, which I've worked on with many other colleagues to get this broader view, if I hadn't done a human science degree. So I'm very grateful for that. It's also affected my approach to both assessments in the field and formal research. And you might wonder why there's a slow Loris up there, but it's very important. Sorry? Yes, the ethnographic approaches I learned in social anthropology have informed my research in social sciences, and the animal behavior taught me just to sit and watch. And this is my last slide. Sitting and watching is what I do a lot of the time so that I can help people. I'm ending here, which is a bit of a jump, but you're all aware of what happened on Lesbos this week. And this to me shows that if we don't take an interdisciplinary approach to the problems of the world today, we will have plenty more of this. It's a tiny, tiny microcosm of what is going to get much worse. The trigger for these fires was the Greek government's treatment of refugees during the pandemic. Now they are sleeping on the streets. We predict possibly 1 billion people moving by 2050 if we don't address the climate chaos and ecological breakdown. The pandemic is just the first symptom of that. No amount of compassionate relief, higher walls will solve this issue. We need an interdisciplinary approach to the problems of the world today, and I'm ending there. Thank you very much.
Fantastic. Thank you very much. Hannah, are you ready?
Let me answer. Sorry, I haven't unshared.
I'm ready, but I need the screen.
Yes.
Yeah, I'm so sorry. I'm just trying to get that bar back. Where is it?
It should be in the middle of the bottom of your screen.
I can't get this to enlarge so that I get my. Got it. There we go.
Okay, well done.
Okay, hopefully you can see some black and white writing now. Thank you very much for listening for the next 5 minutes, if indeed you do. My name's Hannah Bradby, and in the late 1980s, I was studying human sciences at Wadham College. Nowadays, I'm a professor in Upsala University. If you want an income in academia, you often have to choose a tribe, and I've ended up with sociology. My research interests are around the intersection between health and migration and racism and ethnicity. So the current COVID-19 pandemic was of particular interest in terms of the disproportionate number of fatalities that played out for ethnic minorities. Now, this is true in the UK, and I'm going to give some UK examples, but it was true in other settings as well, where ethnicity is measured in different ways. So, very sadly, it was very obvious in the early days of the pandemic that the people who were dying were from Black and minority ethnic groups, initially from healthcare workers in particular. But it became quite quickly apparent that this was true in the general population as well. Now, this was a thing that was very puzzling to news commentators initially, and raised the question as to why this would be so. Lucinda Platt and Ross Warwick published a study from the Institute of Fiscal Studies that I'm drawing on here, in which they looked across a range of different evidence sources to try and answer this question. So population structures were relevant, thinking about younger population structures for ethnic minorities who tend to be urban rather than rural. Employment patterns, of course, the health and social care sector disproportionately employs Black and minority ethnic groups. They're also overrepresented compared to the general population in self-employment and also in sectors that were affected by lockdown, so they suffered economically. There's a lack of financial buffering in households of minority ethnic background. There's differences in terms of housing, in terms of the density of occupancy, but also the access to outdoor space for exercise. Then, of course, there's the epidemiology of underlying conditions, a higher rate of diabetes and high blood pressure that make health outcomes poorer often. There's the experience of racism, which is independently related to poor health outcomes, as well as institutional racism and that whole legacy. And then finally, we get to individual behaviours, so washing your hands and keeping 1 to 2 meters away from other people. Now, the immediate response to these data was to suggest that people were not following the precautions properly, which comes quite close to blaming the victims for their own deaths. So one of the responses to this was then to just say, well, people don't understand the instructions around distancing and hand washing, so translate the instructions into enough other languages and that will solve the problem. So to labour the point, that only addresses the last form of evidence on my list, not the other ones on that list. So the next response, of course, is quite a sensible response is to vaccinate people. That's a good idea, isn't it? A lot of us here would be very pleased if there was indeed a vaccination developed, and we hope that it will. However, a successful vaccination program depends on more than actually just obtaining the vaccine. It depends on a whole set of other systems as well. So, my wider point, dear audience, is that there are a set of urgent global challenges, of which the COVID-19 pandemic is just one. So we could name the obesity epidemic, we could talk about antimicrobial resistance, we could talk about climate change, and we could talk about the interrelations between those, as Lynne and Dougal have already touched upon. These are complex, multi-sectoral problems, and as such, they require sustained interdisciplinary solutions. And of course, I'm preaching to the converted here, I know, but this requires a set of interdisciplinary trainings that allows us to gather, synthesize, critically analyze, and communicate across the range of evidence, which allows us to formulate research questions with both breadth and depth, in order to design research that is complex, creative, and relevant. And that's easier said than done. But this is part of the case in favour of human sciences. I rest my case. Thank you.
Right, thank you very much, Hannah. That was brilliant. Right, and you've unchaired. So, Cathy, we're on to you.
For me.
Or Rachel, you're going to go. Sorry, you're going before Cathy. Sorry, I've got you in the wrong order. Okay.
Doesn't matter really.
Okay, go for it.
Great, thank you, David. Hello, everybody. So I'm going to share my screen, I hope. So my name is Rachel Stancliffe, and I did human sciences in the late 80s also. So I think I was a year after Hannah. And sorry, I'm going to go back to the beginning here. We are, as the others have said, faced with a huge lot of complex problems at the moment. I became most interested in one of these problems, which is the urgency of climate change. So having done human sciences very, very briefly, I did an MSc in demography and then went on to work in the Soviet Union in public health, having done a bit of work in public health in London. As the others have said, very much appreciated my human sciences training and saw the need for cross-silo working in very, very many different contexts as I was working. So at the moment, for the last 12 years, I've been working in healthcare, and partly really because I suppose healthcare is healthcare is where we are most closely maybe brought to humans and how we live well on this planet. Lots of things are important, obviously music and culture and housing and all sorts of things, but healthcare is a kind of symptom, if you like, of all of that, or health is, sorry. And I suppose I'm really, really wanting to help people to stay healthy and be healthy, and recognizing that all of those things that the others have talked about, including you know, which culture you come from, where you live, where you were born, how many children you have, and all of those things that make up human lives come to fruition. And at the moment, in terms of how we help healthcare to become more sustainable, I suppose it's a very, very practical question in some ways, which is, you know, how do we spread the resources we've got over the best outcome to achieve the best outcomes. So we talk about how to maximize value in healthcare, and we think about value in terms of the triple bottom line. So the environmental, social and financial inputs, as it were, into what the outcomes are. So I suppose what I'm talking about here is how we begin to we begin to use interdisciplinary thinking in terms of one area of work. So what Hannah talked about was kind of unpicking things that have already happened and looking at them through the lens of different bits of how we study things. I suppose one of the things that we'd all like to do is to put all of that thinking into how we do things proactively. So how we do things that haven't yet happened. So how we try and help things not to happen, or how we try and help things to happen better. And I've struggled with that, as I'm sure many of you have, who are interested in interdisciplinarity throughout my career, really, actually how we get that to happen. And in a very, very simple level, one of the programs we run is called the Green Ward, and we work with people in hospitals to make changes, basically, that save resources. And those resources we can measure in financial terms, in carbon dioxide equivalents, and also in social impacts that those changes have. But how do we balance those things? You know, for example, there was an article the other day in The Guardian about tea bags. How do you balance the fact that your tea bags are either fair trade or have plastic in them? You know, how do you put things into a basket which come from very different places, I suppose? And so we've talked roughly about this in different settings, but is that something we can actually ever do? Is there a sort of checklist that we have which helps us to do that and consider the different things that are important? Or are there actually ways of stitching those things together in a way that allows us to somehow balance them? So I think what comes to mind is something like, you know, the poverty index, or I don't even know if that's used anymore, but those ways of different, a basket of things, I suppose, which brings different things in. So how are we actually going to do interdisciplinarity better in practical settings? And I think one of the things that many of us felt doing human sciences is that a lot of it is in our own heads. So we were taught these amazingly different things. It was fascinating, and we felt that we came out of it. And I think I did a rough back of an envelope calculations. There's about 1,000 people have done human sciences. So that's great. There's 1,000 people in the world who've done human sciences, who have those different ways of thinking all sort of in their heads together. But how do we really scale that up? Yes, having a prime minister would be fantastic and would make a lot of difference. But if we want people who are skilled in these ways of thinking across silos, how do we do that? Do we encourage many more people to do human sciences? Yes, that would be great. But what are the other ways that we can improve interdisciplinarity and really scale it up quickly? Because, for example, climate change, we know that we have about 10 years to make a real difference. So I suppose I'm interested in what we can do in the next 3 to 5 years that can really help to bring interdisciplinarity to the fore and to skill people up in how to do it better, and not wait for everybody to do human sciences degree, lovely as that would be. I think that's it. Thank you.
Great, thank you very much, Rachel. Right, and Cathy, are you there?
I'm here, yeah.
Great. And
hello, everyone. Well done for your stamina. I'm the last person to speak. You might be relieved to know, and we're very keen to hear from you, so do stick around. So I graduated from human sciences, like Rachel, in 1990, and totally agree with what she said, that the kind of the challenge and the thrill of the degree, in a way, was that it was all about how you become an interdisciplinary thinker in your own head. So everyone's experience of the degree is slightly different depending on how they chose to connect the dots. And I think that's one of the reasons why the degree is so enjoyable. But with the benefit of a bit of time, I think that that might also be one of the reasons why human sciences hasn't had a greater impact. And I'll come on to talk more about that. But so after my degree, unlike everybody else worthy, I spent a couple of decades as a TV producer making science programs. And essentially that's a job of being a translator. And then I returned to academia a few years ago to do a doctorate in educational neuroscience. Educational neuroscience, almost by its very name, it's a new field, but almost by definition has to be interdisciplinary, because it's a very long journey from a brain scan on an MRI to a lesson plan in a classroom, and a lot of translation is needed along the way. And I think I'd sort of naively assumed that because I'd been trained to think in an interdisciplinary way, that everyone else also thought that way. And I was very wrong. And actually, I was shocked after that amount of time outside academia to find how incredibly siloed everything still is, probably even more than before. Because there's so much research, you know, it's incredibly hard to stay up to date even with your own area, and there's no prizes for looking far and wide. There's only really prizes for looking near and pretty narrow for the most part. So the area that I'm studying is creativity, and you know, obviously that's one that people are interested in from all kinds of different perspectives, from psychology to organizational theory to the arts to anthropology. But most researchers, even in something that should be open-minded like that, usually stick to just one approach. So consequently, there's probably someone just in the corridor, a few along from where you are, studying something that is highly relevant to what you're studying, but you'll never even know about it because we don't look. And in my mind, that's incredibly wasteful, as well as being anti-progressive. I think that cooperation rather than competition between disciplines is much more interesting, much more fun. But most importantly, if we feed multiple perspectives into our research at the outset, we're much more likely to come out with things at the end when we're talking about the application that are going to be useful, because we'll have troubleshot and we'll have thought through a lot of the problems and the different perspectives. And as Hannah said about the COVID crisis and the risks to ethnic minority groups, this shouldn't have been a surprise. It needn't have been a surprise. Like we knew a lot of the things that fed into that. So why is it such a battle to get out of your silo? Well, my limited observation, I've only been back in it for a few years, but it's that there are nice words about interdisciplinarity, but in terms of status, money, research grants, professorships, they're almost all associated with deep, narrow knowledge. And there's a lot of something I've heard termed methodolatry, where you still really think that your perspective is the most important one. And it takes an awful lot of time to look outside of your area. And why would you do that if breadth isn't valued? And also the work of translation is really hard. You know, it's much easier to talk to people who know what you're on about, who know your acronyms and know your shorthand, and it makes you feel really clever. But I think it's kind of lazy. And one thing that I did learn from TV is that it is always possible to translate complex ideas. The only thing that really is important is believing that it's necessary to do it. So the real issue is, as everyone has said in different ways and with different examples, is the world is interdisciplinary, even if academic institutions aren't. So it's blindingly obvious, you know, Rachel, Lynne, everyone said it really, that real world problems demand respecting and communicating between and ultimately agreeing on pathways from multiple positions. We've just got to get good at it somehow. And if there's something I've learned from neuroscience, it's that we get better at the things that we practice. It's almost impossible to improve without practice, both through embedding the things that work and through learning from things that don't. But it's hard. And how do we improve our interdisciplinary thinking if there's no training, there's no formalization of the tools and techniques that help us think that way? In other words, if we were to seriously think about how do we make human sciences not a thing that exists kind of in an atomized way in everyone's separate heads, and how do we put it together in some kind of structure? What would that look like? And the pandemic obviously has brought this all home. You know, we modeled the risks of the virus, but we didn't model the risks of social isolation or lost education or increased inequality. So if we're serious about trying to make the world better, I loved your slide, Rachel, how do we solve all the problems of the world? Which, as human scientists, you know, I think we're generally quite optimistic and we want to believe that we can, but we need to train interdisciplinary thinking. I totally believe it. We need to value breadth as well as depth, and that needs to be mirrored in funding, in career pathways, in status. And we need to evolve human sciences to the next level so that the benefits don't just exist in our own heads, but they exist in a way that can be replicated and developed and honed, and put us in a better position to really tackle some of these enormous challenges. That's me done. We would love to hear from people who are listening.
Thank you so much, Cathy. Yeah, that was great. It resonated with a lot of my experience inside the university, I can assure you. Max Weber was once asked, "What is your field?" And he said, "I'm not a donkey, I don't have a field." So maybe that should be our motto. Right, so it's now time for people who haven't spoken, that is to say, the 65 attendees that it says on my top right-hand corner are attending, to ask questions. And the way to do that is to type them into the box, and I can see that some people have already done that. It would be really helpful, of course, if you have a question that is specifically for a particular person, if you specified who you're identifying to. Otherwise, we'll just, but I won't ask all members of the panel to answer all the questions. But we have a question from Pam, which says, "How well do you think WHO is tackling the interdisciplinary issues you have all raised?" Now, which of you would be the best one? Lynne, do you want to have a go?
Well, I work for them, so maybe I'm luckily a consultant. I'm not an employee, so I can speak freely. I mean, the amazing
consultancy.
If you're asking about the pandemic issues, I think it's, you know, to be fair, it's doing the best it can. I was going to ask, interdisciplinarity within WHO is potentially enormously possible, but in reality, for all the reasons that Cathy has spelt out so well, actually quite difficult, because you get, you know, I'm a mental health specialist and I only meet the other mental health specialists. You can go on the website and you can move across the world and you can move across specialties, but actually it's still quite siloed. And so that a short answer is it needs challenging and it needs reaching out. The good thing is, in devising guidelines and so on, is that the potential is there, because there are all these amazing people who are employed by this organization, and you know, you can say, we really need to hear from social anthropologists, whoever. So
does WHO have a policy on interdisciplinarity?
No, I don't know, so I can't tell you. Not that I know of. I mean, sorry, I don't know. I'm just a consultant, so.
But what you're saying is some of the people who work for it are demanding it.
Yeah, and within the mental health field, what's lovely is that we've really moved away from biomedical focus, and that's fantastic. You know, I said we saw the impact of it's through WHO guidelines and, you know, and the Interagency Standing Committee, which includes WHO, they're central to it, that we've said, you know, no single focus trauma programs that just concentrate on medical disorders, take a cross-cutting approach, involve the social sciences and all of that. And that I've seen in psychiatry, in mental health, how interdisciplinarity has come in an amazing way. And I'm sure that's happening in other areas. Yeah.
I would say that there's a problem with the nature of medical evidence, full stop, that makes it very difficult to be interdisciplinary. So we could have another discussion about kind of the politics of epistemology, which would come some way to answering the WHO question. The other problem is that the WHO doesn't really have any teeth. So asking it to do stuff.
And it's just had a couple of those teeth knocked out recently, hasn't it? So, okay, I'm watching the clock. So we have an interesting question here about whether women find interdisciplinary thinking easier than men. Dougal, would you have an opinion on this?
Well, I would like to think not. That's all I can say. I know that when we were discussing this panel, I said that I wasn't sure I was qualified, and you three very lovely women said, we need you on the panel, Dougal, so we've got a man. So maybe there is something in it. I don't know. Can you tell me what the proportion of female to male undergraduates is at the moment in human sciences?
Probably even more unbalanced than the panel is. So so the panel may simply be reflecting the gender percentage.
Although when I was doing it, I think
Exactly.
it was the other way around, wasn't it?
Yeah,
Lynne?
just me. Yeah, I was the only one.
The men had the longer hair, but there were more of them.
Okay, well, times have changed. Anybody else want to jump in on this one before we move on to the next question?
Well, I'll just say very quickly that, I mean, I employ 15 people, and 13 of 14 of them now are women, sorry. And in sustainability, in sustainable healthcare, and we've definitely seen that in sustainability, there's a sort of overbalance of women, and it's quite hard to get enough men. And I suppose there's that old thing of, women are supposed to be better at juggling things, aren't they? And so looking at multiple things at one time, I have no idea, Cathy, in terms of neuroscience, whether that's really true or not, or whether it's that thing of, because you practice it more, then you get better at it.
Okay, and we're not going to solve that one. There's a practical question about whether alumni could be encouraged to get involved in interdisciplinary work. And the answer to that is, I hope. I mean, I believe, maybe something to do with the fact that human sciences has a relatively, small alumni base compared to, say, PPE. So I think the human sciences alumni base is, has a strong sense of solidarity, and a lot of people are involved. So I think, and I think Sarah Jane has a very good email list and so on. I think people do read the newsletter. So I think the answer to that is yes. Okay. Yeah, go on, Cathy.
Can I jump in on that as well, just to do a slight sort of poster call that some of us are really trying to think about this, how we can sort of formalize the processes set up in the human sciences degree, and maybe even think about postgraduate work or other ways of kind of like embedding it a bit more. So I don't know how it works GDPR wise, but I'm sure Sarah Jane is all over it. But if you're interested in being part of that discussion, please do let her know, and we will be in touch with you sometime soon.
Thomas, I don't know if you can hear me, but if you want to jump in, please say so.
Yeah, thanks very much. I think this conversation has been really it's a good moment to have this conversation, precisely because we've got this wealth of experience and expertise, and we're in this moment of thinking about, well, how should we plan a human sciences degree to address the challenges of the world in the next few years and decades, and some of you spoke directly to that. So it would be great if we could draw alumni in more powerfully into our thinking and discussions in the degree program and more broadly across the university. And I like very much the idea of connecting across postgraduate degrees as well. And there are really interesting pedagogical questions about how we think in an interdisciplinary fashion, which you've all touched on as well, which I don't think we have the answer to that. I know that there's lots of writing around this, but...
So Thomas, while we've got you there, let me just, for those who don't know him, Thomas is the kind of future of human sciences in Oxford. He's tutor for human sciences at St. Hugh's, and very much, very broad in his interests. So perhaps while we've got you there on the screen, Thomas, do you want to answer the next question, which is, how would you characterize interdisciplinary thinking?
That's a great question.
In one sentence.
Perhaps I'm not foolish enough to answer that, but certainly, I'm a social anthropologist by training, and I have a degree in environmental sciences as well. But speaking as an anthropologist, I sort of and it clearly resonates with all of the what you all said today. There is something about being able to listen and attend to people and to the context in which in which you encounter people, the humans supposedly that we study, but also to be able to really attend to the environments in which people find themselves. So in our context, I would say that interdisciplinary thinking entails something about that kind of receptivity and responsiveness, not only to people and context, but also to ideas and debates and forms of evidence. And so, I think in human sciences, we've got so many great colleagues, such great research. We really have a very wonderful and thick conversation, and it's the fun part, I guess, is thinking of ways of continuing to innovate that and to address the new challenges that come up. We have a sense of what the challenges are in the world at the moment, but in a sense, we always have to retune our ears and our eyes, as it were, to the new forms of life, new forms of challenge, new forms of environmental challenges that we face. So I like very much the idea that we draw all of you all into our thinking and our conversations.
This is just to reassure you, we are thinking about how to refresh and reorganize all the human sciences degree all the time and make it sort of fit for the 21st century. So yeah, input from you, all of you, would be very helpful. Andy Gosler has just commented in the chat box, interdisciplinary thinking starts with respect for the expertise of others. So I think that's a nice little tagline. Anybody else, before we move on, anybody else want to have a go at this? Or shall we take the next question? Cathy.
I mean, I sort of feel like we should, because this is really the sort of meat of it, isn't it? And I wonder whether, it is a difficult term, because I've heard interdisciplinary applied to things which to me feel incredibly close. If you use structural equation modeling as well as linear mixed models in statistics, you're really interdisciplinary. Whereas in my mind, you're a better interdisciplinarian the further afield the things that you're pulling together are. It's a continuum, I think, in that respect. But I wonder also whether that slightly nebulous definition of it is partly what's made it harder to kind of actually crystallize tools and techniques for thinking in that way. And we've sort of started talking about it a little bit. And, at one end, you do have attempts to make tools that kind of give a common denominator for different specialities. So one thing is, something like QALYs, which are quality adjusted life years, were an attempt to put mortality and even the most minor effect on morbidity into the same kind of equation. And that's one way of doing it, is you kind of reduce everything to a number. Or there was something we talked about recently when we were talking about this session, which Rachel, you mentioned, which was, I think, inspired by Gawandi's checklist. The idea that actually you just have, for every project you're working on, you have a kind of anti-myopia checklist, which means that, one of the things that you have to do before you're done is, a range of things which are essentially driven by people from, who are coming at that problem from completely different angles. So I think, really, I think there's a communication which is absolutely essential to it. I think I like what you said, Thomas, about kind of a receptiveness to other people's ideas. And from the person in the audience, sorry, I can't remember your name, who said, it's essentially about respect. It's about respectful communication. And I think if you have a shared problem that you're working on, that helps, because that kind of drives things towards a goal. But I think it feels to me almost like the thing we've talked about, that human sciences is great, but it's stuck in individual brains, I think applies to a lot of interdisciplinary problems in the world. People feel like they're inventing it for themselves anew every time. And I think we must be able to do better than that. Sorry, I didn't really answer what it is, but no, I'm just going to mute myself.
Okay. Anyone else want to jump in? Rachel.
There's something on so Hugh's posted on the Q&A or the chat, which is, so he's written, and sorry, I don't know who Hugh is, I can't remember. Human sciences should seek to develop a specific discipline based on the semantic, political and methodological integration of knowledge fields. And you know, I think that's basically what we're saying, isn't it? That we would like it to be not just the piecing together of things in individuals, that we would like some more, either for the undergraduate degree, but then also actually developing that going further. I would love to have stayed within human sciences. I mean, we've all gone back into a box.
Yeah, I mean, that one of the questions is what is the relationship between human sciences and the Martin School, 20th century Martin School, and the answer is none, and that's because human sciences doesn't have a research arm. So people who teach in human sciences, of which there are many, and we're going to try and get them all up onto the website, which they're not at the moment. It looks as if there's only 3 people in human sciences, which is absolutely not the case. But they all, you're right. You have this very broad education, and then you move into your tribe, your silo, or your box, and then people are supposed to come together somehow. So ideally, what we need is a kind of is a postdoc version of human sciences, which welcomes people from all kinds of different disciplines. And I think from that point of view, the fact that human sciences is housed within anthropology is actually serendipitous, because anthropology is the most kind of interdisciplinary discipline. It's about, we have people who are doing very basically doing what psychologists do, or even what neuroscientists do.
If I was a proper sociologist, I might have to take you up on that. About
yes, yeah. Well, I know sociology would also claim to be the same. But I anyway. Look, let's not have a sociology anthropology fight about this. I mean,
I wouldn't, because I'm a human scientist.
Yeah. Anyway, the fact is, sociology at Oxford is very narrowly quantitative, whereas anthropology does pretty much. That we could find people in anthropology doing everything. But whether that enables us to create a graduate human sciences school is another question.
Let's make one really minor personal point there, which is one of the most fantastically exciting things about being a human sciences undergraduate, was that there were no human sciences teachers. So you were the person who was making the synthesis. Yeah. So that's the only problem with the otherwise very interesting suggestion that so how you can make an interdisciplinary postgraduate study which does not become didactic very quickly, I suppose.
Yeah. Well, exactly.
Nodding, Thomas.
Yeah. Does anyone want to continue running with that ball, or should we go for a different question?
Let's see. I think it's important to hear from people on the floor, and maybe we can tie in other points as we answer.
Yeah. A rather specific question for Rachel from Marini Edwards. You mentioned that where you were born is important. Could you explain why? And is it more or less important than where you grow up?
Oh gosh, that's very specific. I don't think I didn't make.
Maybe. Do you want to pass on that one?
Yeah, well, yeah, I don't want to make a big thing out of that, but yeah, interesting question. Very human sciences question.
And well, there's a neuroscience education question. Is interdisciplinary thinking something that we naturally do, but we are taught out of by siloed education? Or is it a method of thinking that we must be taught? So that's another way of approaching the question. Are we all natural interdisciplinarians? And we get it beaten out of us through our over-specialized education system, as many people believe.
I mean, I hadn't really thought of it in that way, but I think my instinct is kind of yes. I even remember kind of going back to A-level choices, thinking, this seems insane now that I'm having to choose. I'm having to go sciences or arts. I'm 16 years old. This feels really wrong. So I think,
it was really wrong. England, Wales, and New Zealand, I think, are the only countries in the world where you can give up physics at 13 and maths at 14. And it's completely bonkers compared to the rest of the world.
Mm. Yeah. So I would say, I mean, yeah, I think it depends how far back you go, but I would say, yes, I do think it's something that is sort of taught, not so much taught out of us maybe, but kind of demonstrated out of us by the people who you see who are influential tend to be a thing in particular. It's not it's kind of back to what's the kudos and where's the status and where's the money and who are the professors. I think in an academic way, I think it probably is something that we're, you know, that it's modelled less and less well, and we do, it's reminding me of the famous Picasso quote about children being artists, and the difficulty is staying one as you become an adult. Is there an interdisciplinary limb to that same thought? I think maybe there is.
Yeah. So I think that's a worldwide problem, but it's a problem that we have in spades in Britain because of the two cultures and because of snobbery about science. But yes, I would agree with that. Hugh has pointed out that Ron Harry was never able to translate any of his philosophy of science books into German. To my knowledge, he tried at least 4 different translators. So I'm not sure I agree with you that information can be independent of psycholinguistic structure and that everything can be translated. I don't know, did somebody say that everything can be translated? Maybe Cathy said that when she was talking about it. She was talking about a kind of different kind of translation, but anyway.
So if we've got 5 minutes left, what are the suggestions? 4 minutes. What are the suggestions for kind of, you know, positive next steps of things that we would all like to do? Do we all just want to write them in the chat, or get in touch, or? I mean, we want more people doing human sciences, definitely loads more. How are we going to do that? We want some postgrad thing. How are we going to do that? We want to have a big 50th birthday party.
Yeah, well, I'm afraid one of the things that obvious answers is to say that, you know, everything costs money. I mean, there are definite constraints within Oxford. If we're talking specifically and somewhat parochially about how to change human sciences at Oxford, you know, we simply aren't going to get a big, sudden, huge expansion of human sciences, because if every student place is marked, you know, expansion in one area means contraction in another. So people have to be willing to give up places. And on the contrary, that's why we've lost various colleges in the past, because people wanted to snaffle our undergraduate quota. We're very lucky this year. We're going, you know, silver lining of the A-level fiasco is we're going to have 37 students, which is counts as, by recent standards, counts as a bump a year. What we'd really like to do is get up to 40, but we're never going to get up to 220 like the PPE, or, you know, it's simply not going to happen within Oxford's structure, unfortunately. Lynne.
2 directions. One, I wanted to echo what Cathy said, especially as I think I wanted to say education, you've got to start earlier. I astounded my school by wanting to do biology and English and geography. I was allowed to, but it was exceptional. We should be getting into schools and challenging that division, that choice you have to make at 14, are you science or arts? Because it's really damaging, and many people don't want to have to make that choice. And that would, I think, foster more going into degrees like ours. But secondly, after, and this is a really practical question, I don't know what connections you have with the Department of Refugee Studies, but what I love about the humanitarian world and humanitarian academia is, for me, it feels like a continuation of human sciences. If you're going to do anything in humanity, I teach on a master's course at Fordham in the States, and the States is much more friendly to interdisciplinary study. But we bring everything into the teaching we're doing: sociology, politics, psychology, anthropology, as well as medicine. It's a mental health course, but I insist on all those topics. And I think, I don't know, David, what is the connection? Because there may be potential, if we could have a master's that in human sciences, it would be very, very valuable to anybody in the relief or humanitarian or international development world.
Yeah, well, of course, we know those people. Anybody else? We've got literally 1 minute, so you've got, if anyone has 10 seconds worth of wisdom they would like to share on interdisciplinarity. Cathy.
Billionaire alumni watching, think about setting up a lovely new centre.
Yeah.
That was less than 10 seconds.
To just say that I'd like to look at things slightly from the other end and ask how we can get human science graduates into politics and the civil service. And is the problem, I think, is partly to do with the criteria that they expect. And I don't think they would regard a human sciences degree as a particularly good qualification, and I would argue the exact opposite.
I will say that, but one of our recent graduates from St Hugh's is going into civil service training at the moment. So
very good. Very good. Good luck to them. Right. Well, I'm afraid I hear the bells ringing, and gosh, this has been really, really interesting. It's been lovely to see you all, and we will be in touch. Sarah Jane is the keeper of all our records, and I hope this session was being recorded, so I hope everybody's okay with it. If anybody has anything they've said that they want to be cut out before it goes on our brand new YouTube channel, please let me and or Sarah Jane know. Thank you all, and good night.
Bye, thanks.
Bye.
Bye.
À la prochaine, mes amis.